I focus entirely on hip and knee surgery, particularly hip and knee replacement, using artificial joints to replace diseased joints. And I'm also involved in designing new devices. And it's a very dynamic field. It involves a lot of new materials and engineering challenges. Because when I first got in the field, hip and knee replacement was largely a procedure for older patients. And the biggest change in the last 20 years is that the fastest growing segment of the population that's having hip and knee replacements are younger patients in the 35 to 55 range. And these patients are much more active, they live longer, and they want to perform or stay in much higher level activities. When I was in training 25 years ago or so, an average total joint patient stayed in the hospital for almost 2 weeks, 10 days to 2 weeks. Our average length of stay now is just over 2 days. So we've made a lot of improvements in the anesthesia, the pain management, the rehabilitation, so that the whole process is accelerated. Just doing hip and knee replacement over a 25-year period where you're averaging 300 or 400 cases a year, then you're talking about 5,000 to 10,000 procedures. And over a period of time, as the techniques evolve and the materials and implants evolve and the types of patients evolve, you're able to keep up with this so that as these small incremental changes occur, we try to stay on the forefront. Well, one area that we've taken the lead is in hip resurfacing. The technique is very demanding, and the surgeon performing that, there's a learning curve associated with it. So that's an example of, if you use the right technique in the right patient and get it in just the right position, the results are phenomenal. But it's a procedure only for very young, healthy, active patients. But still, it's maybe 10% of our total hip population, but it's the most active, demanding 10%. I think the most satisfying part of orthopedics, particularly what I do, is the ability to return somebody to an absolutely normal, pain-free lifestyle and allowing them to return to the thing that you love to do most.